Our bodies require food to provide the energy and nutrients necessary to function. For this reason, we are responsible for ensuring we eat the right amount and types of food. However, the food-related temptation is hard to resist, especially since the tastiest food is typically junk or unhealthy, which can be detrimental to our overall health. If left unchecked, overeating can lead to issues such as obesity. Obesity is when a person has accumulated too much body fat to the point where their health may be negatively affected. It is most commonly caused by an energy imbalance between the number of calories consumed and the number of calories used. However, obesity is not just about body fat. An obese person may also experience other issues, such as shortness of breath and skin issues. For this reason, one must know the different symptoms of obesity. The different symptoms of obesity. It is worth noting that though most obesity symptoms are alike, they can manifest differently in children and adults. Obesity is also considered a disease that must be treated, which is why one must be proactive to lose weight. With this in mind, here are some of the most common symptoms of obesity in children. 1. Acanthosis nigricans, dark velvety skin around the neck and other areas. 2. Constipation. 3. Early puberty in girls and delayed puberty in boys. 4. Fatty tissue deposits, particularly around the breast area. 5. Gastroesophageal reflux disease, GERD. 6. Low self-esteem. 7. Orthopedic issues, including flat feet or dislocated hips. 8. Sleep apnea. 9. Shortness of breath due to physical activity. 10. Stretch marks on the hips and back. Early onset obesity. Early onset obesity can manifest in children due to genetic conditions. These include 1. Pro-opiomelanocortin, POMC deficiency. Obesity. Symptoms include hyperphagia, extreme hunger, obesity that starts in infancy, and hormonal problems. 2. Leptin receptor, LER, deficiency obesity. Mostly the same as POMC deficiency obesity, but the difference is that hypogonadotropic hypogonadism is a factor. This is when the testicles or ovaries produce little to no sex hormones. 3. Bardet-Biedl syndrome, BBS. The same factors apply, but other factors include vision impairment, polydactyly, having an extra finger or toe, and kidney issues. Symptoms of obesity for adults. As for adults, the above symptoms are the same, though some are not found in children. These include back and joint pains. 2. Excess body fat, particularly around the waist. 3. Frequent sweating. 4. Inability to perform physical tasks you can perform before your weight gain. 5. Mild to extreme fatigue. 6. Psychological issues such as negative self-esteem, depression, shame, and social isolation. 7. Shortness of breath. 8. Skin problems due to moisture accumulation in the folds of fat. 9. Snoring when asleep. 10. Trouble sleeping. Symptoms of obesity. Morbid obesity. Morbid obesity is having a body mass index, BMI, of 40 or higher. It is a severe medical condition that can lead to various health complications, including heart disease, stroke, type 2 diabetes, high blood pressure, and certain types of cancer. Treatment for morbid obesity typically involves lifestyle changes, such as diet and exercise, medication, and surgical options. What can happen with symptoms of obesity? If obesity is left unchecked, it can cause various health issues. Some of the most common ones include osteoarthritis. Osteoarthritis is a joint disease caused by the breakdown of joint cartilage and underlying bone. Obesity can cause it because it strains the joints by exerting more effort to move. Type 2 diabetes. Obesity can increase the risk of developing type 2 diabetes because it can reduce the body's sensitivity to insulin, the hormone responsible for regulating blood sugar levels. When the body becomes resistant to it, it can lead to high blood sugar levels and diabetes. Heart disease. Obesity increases the risk of heart disease because it can lead to other conditions such as high blood pressure, high cholesterol, and diabetes. These conditions stress the heart more and make it harder to pump blood. Asthma. Obesity can increase the risk of asthma because it can lead to inflammation and changes in the airways. This can make it more difficult for the lungs to function properly, leading to an increased risk of asthma attacks. Cancers. Certain cancers, such as colorectal, endometrial, and postmenopausal breast cancers, are linked to obesity. This is because obesity can lead to increased levels of hormones in the body, which can increase the risk of certain types of cancer. Obesity can also increase inflammation, increasing the risk of certain types of cancer. Kidney disease obesity can increase the risk of kidney disease because it can lead to high blood pressure and diabetes, both of which are risk factors for kidney disease. Symptoms of obesity. Helping a person with obesity. If you are struggling with obesity, you must seek help from a healthcare professional. A doctor can help develop a plan that includes diet and exercise modifications and potential medications or other treatments. However, the story is different if it is a loved one with obesity. First and foremost, they are aware of their condition, so avoid judging or shaming them. Instead, be supportive and talk to them about the potential health risks and how to make positive changes. Offer to join them in their journey to health and make sure to encourage them along the way.